to give you whatever the information I can provide you. As I've talked about, it's nothing like having a morning coffee. Health care and health insurance. What is healthcare? Healthcare is when you receive the care from a provider, either the hospital or a doctor or a hub or any diagnostic facility, including prescription drugs. It is healthcare. You're receiving the care. How do you pay for this care? So today's topic is, how do we pay for this care? How do we finance it? What are we, as Americans, what do we have? What are the options we have? This is my goal, is to give you the options. You guys decide. Yes, agreed upon? This has been a personal goal of mine, give you the healthcare education. I've been in the healthcare for the last 40 years. So I've seen it all. So how do we finance? Let's talk about it. Let's not waste time. How do we finance the healthcare? So healthcare can be financed at least 3 different mechanisms. I'll talk all about what are the mechanisms. One is the insurance premium. That is number one, insurance premium. Number 2, savings. It could be taxable or non-taxable. It could be health solutions, HSAs or HRAs. I will explain to you in detail. I will call this HSAs. I renamed HSAs instead of savings. I would call it as Health Solutions Advantage. I call it a rainy day fund, folks. I would like to call it as a rainy day fund. I think the government likes the rainy day fund because we have been having a lot of the deficits in the government. So I call it a rainy day, personal. It's a for health. This is only for health I'm talking about. Personal health. This is an asset, folks. You guys need to understand, this is an asset. A lot of people don't seem to get it. I don't know what is it. This is your asset. You need to take care of your health, man. We all have to take care of your health. It doesn't come free. It doesn't fall from the sky. We need to take care of our own health. Nobody's going to give you. There's no free ride, folks. If you're expecting a free ride, no, it's not there. You know, either one way or the other, you pay for it. How you pay for it is your responsibility. But I believe Americans want freedom from healthcare shackles, so-called shackles. Why do I say shackles? Yeah, because to see a doctor, you know, you have to see only this doctor. You cannot go to this facility. You have to go this many copays, this many deductibles, how much they will cover, how much they don't pay, how much is your out-of-pocket. These are all things, it affects you personally. Yes, it does. But a lot of people don't seem to realize it's, if Medicare for all is not going to give you all those benefits, folks. I want you to guys have a personalized healthcare. It is achievable, folks. You know, you may not know it, but it is achievable through what I call it as a public-private partnership. I'm not talking about completely privatized. No, it's a public-private partnership where you need to engage. This country is based on private enterprise, folks. You cannot have one size fits all. You know, we have people coming from Canada, Europe, all over the world coming to the most advanced healthcare delivery we have, but it's too costly. We want to address how to lower the cost, how to pay for the premium. I'll give you a scenario. So one is the insurance premium, the other one is a savings, so-called rainy day fund. Third is incentives and rewards. You have to have incentives and rewards. Anything, this is your personal, that's the personal behavior, folks. Anytime people get, free stuff, incentives and rewards, 10% discount, 20% discounts, 70% discounts. You see it in the retail. Why can't we have incentives in healthcare? So let's talk about recognizing these. Healthcare can be financed through 3 different approaches. Let's talk about in detail. What are those 3 approaches? Because Affordable Care Act focus on only the premiums, folks. It's only the premiums. Right now, the premiums are based on general risk pool. I want you to get it. When you say general risk pool, you're paying for the uncompensated care provided by the hospitals. You're paying for everybody else diabetes, everybody else hypertension, everybody else obesity, everybody else drug addicts. You're paying for it. Your premiums are based on that. I want you to get that into everybody's. You're paying. It's a general risk. These insurance companies are very smart, guys. They are very smart. They have lobbies in Washington. They don't want to segment the risk. They want to make money, folks. This is where they want to rip you off. They want to rip you off, the consumers. So they don't want segmentation. They've been fighting so hard against HSAs, against the rainy day fund, against health solutions advantage, against so-called health savings. They have been fighting hard against. And some of the insurance carriers have gotten smarter. They have started buying the health savings. So they want to be in charge. They want to still control you. There is no, somehow they want to get to you to make money. I understand the business folks. We all want to make money. It's a human behavior. I don't blame them. I really don't blame the insurance companies. They, when you talk about $3.8 trillion, which is bigger than the national defense budget, you obviously have lobbyists. You have lobbyists in Washington. You have lobbyists promoting their self-interest, not in your self-interest. You don't have a lobbyist. Only lobbyists you have is for the retired folks like me, AARP, but they are doing a lousy job, folks. They're not helping the retirees either. I'll talk about that. This Medicare thing, Medicare is dysfunctional as far as I'm concerned. Medicare is dysfunctional. Medicare cannot take care of you all because it is dysfunctional. I can't believe people, when ignorance strikes in your head, people go for it because it's free. But you guys need to understand, it is not free. It is not free, folks. You are paying for it. You're paying through your sweat and blood all your life. That's how you reach the Medicare benefits. But you paid into the system. I want America, I want the government to invest in you, not into the intermediaries. Like, you're seeing this bombarding of this, enrollment period. You see so many ads, internet everywhere. They want to give you free eye coverage, free dental coverage, free this, free that. Believe me, folks, there's nothing free in this world. You're paying for it. You know why they're doing this? They want the dough from the HHS. HHS is pumping the money, your hard-earned money, pumping the money into the stupid intermediaries. I want ARPs, if you are listening, give that money back to the seniors. Let them make the choices. Invest in America, invest in seniors, invest in, your own members. because you guys are not doing the, you're not going after the dirty job what the HHS is doing. They are putting the money into the intermediaries, into the full risk contractors. I have some of these doctors accepting. What they get is they get this. I don't know what the amount is, but I can give you a rough idea. $1,200 per member per month. They're getting that money. Once they get to that money, they want to cut down the services. They are making millions and millions. These full risk contractors, managed care, they get millions and millions. Very first thing, once they have the contract, they cut down the services. They cut down. That's how only they can make money. They have an administrative cost. They have several, they have a payroll. Why do we need these stupid intermediaries? Because it's costing and they are wasting the money in this intermediate. Why don't you give that money to us? Invest in us as Americans. We deserve it. That $1,200, give it back to me. I will go and get an insurance. I will go and get a high deductible, so-called health disclosure, healthy price, HTH. I can get the HTH account a lot cheaper than what these companies are doing. I can save money and put it into my own rainy day fund. Doesn't go anywhere. It goes into my personal accounts. Folks, ARP members, if you're listening, this money you should be getting. And ARP, Medicare, that's another thing about being in Medicare. You can't contribute to a rainy day fund. Can you believe that? You cannot put money. If you have additional money you want to put aside for your future healthcare needs, you can't do it because you're ineligible. Ineligible. Because young folks, I can imagine, but old folks, they want to take your money, pump the money into the intermediary, and they don't want you to have HSA. They don't want you to put aside your health. This is my health. Why do I need somebody telling me where I can save, where I can put my money aside? As long as I put money aside, as long as they mandate it, I will contribute to my own rainy day fund. I will contribute. It has a triple tax benefit, folks. And I'm getting distracted because every time I talk about this health solutions advantage, I get distracted with this. This rainy day fund, health solutions advantage, health save. This is all your money, folks. It has a triple tax benefit. Contributions are deductible. Returns on your portfolio are deductible. Compounding, you get 10% returns on your investments. It is tax-free, and withdrawals are tax-free. It has a triple tax, and Medicare's seniors should get that $1,200. They can take care of their own health. They don't need somebody telling us, you have to go to this doctor, you have to go to this, you have to pay this much. We can take care of our health. If people who can't take care of their health, let them have exchanges through a government. They can have healthcare exchanges and they can provide this service. What happens? People who are eligible, they should be given they're entitled to that $1,200 so we can have our own. So talking about the financing the healthcare. So Obamacare focused only on the premiums, whereas personalized health insurance recognizes if you take away these restrictions, private markets will develop products. Private markets. This has never been done before. People tell you, oh, we have tried this. No, this has never been done. Come with products, provides services with premiums, savings, incentives, rewards. Private markets, folks. And you are in charge. Majority of Americans want that. You want to take care of your own asset. You want to take care of you can mandate have a personalized health insurance for all Americans. You can do that. People who need the help, we will provide you the help. People who really can't afford the insurance, we'll give you the personalized private health insurance, not Medicaid, not HMOs, not Medicare HMO, PPO, not a bronze plan, silver plan. Come on, folks. Silver plan, gold plan. This is called your class, you're creating a class system. Why create a class system when you can have personalized health insurance of your own? You are in charge. You shop. You take care of your health. This is what people want. The private markets, so far, we have never been given a chances. The so-called insurance lobbyists have been controlling this healthcare for too long, all this time. We have never put the consumers in the front line. These personalized healthcare innovations would provide consumers with low-cost financing options that meet the consumer needs, not anybody else. That meets your needs. That meets your needs. Yes. Personalized health insurance. Personalized health insurance expands the ability for consumers to offer multiple plan designs, folks, multiple, that provide financial incentives to plan members who are compliant. Basically, if you guys are in charge, obviously you want to take care of your personal asset. So you will be compliant with healthy initiatives. If people are compliant with the healthy initiative, they're incentivized, they're rewarded for being compliant. It's like anything else, folks. It's like anything else. You're being rewarded for your good behavior. Right now, Americans have retail industries. They give you so many discounts, so much. We need that in healthcare, man. We really need it. We need it. We need it. Federal laws should be changed to allow tax advantaged rainy day fund, HSAs, so-called rainy day fund of any plan design. This rainy day should have any plan design. It should have, these are account-based plans. This is, and you control 100%. Nobody tells you what. You control it. Nobody can take it away. That is your right. That is your asset. Your health and your rainy day fund is yours to keep. And you can give it to your children if you want. Yes, you can give it to your, because you have saved and you have hard-earned money, which belongs to you anyway. So nobody can take away that. Account-based plans support financial rewards and incentives for specific healthy behavioral changes. Yes, healthy behavioral changes. So consumers willing to make good health and healthcare choices. I'm telling you guys, obesity will be solved in a heartbeat if you personalize healthcare. Because we don't focus on food. Because people, they're not looking at that. And this mental health is a challenge, folks. Once you give them the personalized healthcare, believe me, mental health issues, which now they've compared mental health parity loss, they're comparing to physical health. These mental health issues will be solved. One of the problems with obesity, folks, you probably guys don't realize. I've seen over people when they're depressed, that's all they do is just start eating the wrong food, guys. We need to change the behavior. How do you need to give them the incentives and rewards for the people to change their behavior. That's how it works. That's how the system works. Every American should earn the rewards and incentives in their individual or a small group plans that can be used to offset any deductibles. And right now, you're paying for it, any deductible and co-pays. Right now, you're paying. That can be, if you have a personal care accounts, that becomes this co-pays and deductibles and out-of-pocket expenses becomes irrelevant, folks. It becomes irrelevant because it's your money. You want to save. You want to save it. These outdated state laws prevent insurance from providing incentives to a small employer like mom and pop. They prevent you from participating in this. The state laws, they're outdated. And the fully insured groups are allowed should be able to participate in the larger employer, self-insured. Again, people who are under 50 employees, this ERISA law, whatever the federal law is, even if you have under 50 employees, they should be able to participate, so-called larger employers, self-insured plans like HSAs, HRAs. They should be able to do that. HSAs is the way to go. That is Health Solutions Advantage. Incentives and rewards have proven to lower the cost. That's the only way we can lower the cost of the healthcare. Right now, we are wasting that money is being wasted. I have calculated, simple folks, I have calculated. Family of four, employer contributes roughly $14,000 to $16,000 for an average employee salary of $55,000 and over. 14 to 16,000. So I multiply by 160 million. Do you guys know how much it is? It came to $2.88 trillion, folks. Year after year, pumping the money. Where is it going? God only knows. That money is being wasted. I wish that money is putting into your pocket by participating, portion of the money, getting HDHP, health disclosure, healthy pricing, HDHP. You need to have an HDHP. Traditional insurances, forget it. We don't want to buy. I think traditional health insurance should be banned as far as I'm concerned. They need to be taken out of the system. Everybody should have health disclosure, healthy pricing, HDHP. It's called personal health insurance, personalized. HIP, health insurance personalized. You need to buy the health insurance personalized with a lower premium. That's what it is. HIP is nothing but personalized health insurance. You're buying at a lower premium, which will lower their premiums to almost 60%, folks. I'm not kidding. Lower. That money that you're saving, put into your rainy day fund, Health Solutions Advantage, HSAs, health savings. Yes. Incentives and rewards have proven to lower the cost, improve the health, as I was talking about, mental health. You're talking about obesity. We have a problem with obesity, mental health, and that is a major challenge. Drug addiction, yes, that can be all solved once you empower your consumers on their own health. Alcohol addiction, drug addiction is rampant. That can be addressed. And once you empower, human behavior is such, they want to save. They want to save and chase the dollar. If you give them the incentives, they'll go to any extent to take care of their health. And reduce the unneeded use of medical care. Right now, it's being abused. Unnecessary surgeries, unnecessary Things, insurer, the consumers will decide what they want. If they're worth it, they will look at now the information technology is such, so-called Google medicine, folks. You have the information right at your fingertips. You need to take advantage of it. Do you really need surgery? The information is right in front of you, folks, right on your phone. Check it if you really need it. And it's being checked about, so that is, incentives could be ordered or can be offered for wellness, condition management, physically fit, disease management, health improvement programs. We can focus on who needs the healthcare the most by segmenting the risks. We haven't come to that. When you segment the risk, right now, traditional insurance is based on general risk. What I'm talking about, personal health insurance addresses the premiums, lower the premiums by segmenting the risks. There are 4 risk categories, folks. Well category people, majority of Americans, 80% Americans are healthy. Their premiums need to be lower. Well category, at-risk category, smokers, drug addiction, you name it. They're at risk. Their premiums are based on at risk. And number 3, chronic illness. This is where chronic illness folks are the one need the most attention, and they're the one who's consuming, putting a lot of claims. I would rather have the pay as you go basis rather than submitting the claims. That billing system is old fashioned, guys. So that needs to go. So that needs to be paid. The 4th category is so-called catastrophic. So at well category, at-risk category, chronic illness category, and catastrophic. They need to be segmented. Premiums have to be based on the segmentation, folks. Premiums have to be based on segment. Right now, you're paying for Tom, Dick, and Harry, for everybody else who are mentally sick, drug addiction, no health insurance. You're paying for your illegal Americans too. I'm not kidding, man. I'm not kidding. Your premium is paying for. That's why your premium keeps. Now, what the affordable Obamacare does is they're basically making it difficult for the private insurers to compete with the government public option. Why do you need competition with the government? Private sectors can thrive on their own. Why do you need bring the competition to the public? Government is the last one should compete with the public option. Private enterprise system. Private enterprise can thrive on their own. Yes. You're talking about incentives. I'll tell you, incentives can include merchandise, gift cards, debit cards, premium discounts, you name it, man. You name it. You can have incentives like, HSA contributions, co-pay reductions, deductible reductions, co-insurance. There are so many options, so many incentives. Lower your employee contribution. Employee contribution. Yes, you can lower your employee contributions by being healthy. You're being rewarded. So those are so many options we can incorporate that by private health insurance. Personal incentives and rewards can lower the cost, overall cost by more than 20%, folks, more than 20%. ERISA, which is a federal law, federal employees, the ERISA allows individual incentives based on health status of the self-funded groups. ERISA allows that. So we need to expand that. We need to expand even to the smaller employer groups, even to under 50 employer groups. They should be able to participate in this larger employer. The smaller, under 50 employers should be able to get a premium, what they're getting at the larger employer. They should be able to, yes. Federal Department of Labor allows incentives up to 20 to 30% of the premiums for health stats, unlimited incentives for participation rewards. ERISA loves that. There are potential personal savings that will be in addition to the potential of a group pool utilization savings, as I mentioned earlier. So it benefits the employer and employee, folks. The other day I met a gentleman. He was telling me, oh, I don't pay for any item. I have a PPO. I asked in detail, what do you mean you have a PPO? Who's paying for it? Oh, I don't pay for it, but I have an HSA. That's new. You have a PPO, you don't pay for it. And you have a health savings, a rainy day fund. That's a beauty. So I asked more questions. I wanted to know, what is this? He has a PPO. There's no way you can have what it is. This is employers who are smart. They're really smart. You know why? Because employer knows you're a healthy individual, young individual. He can save that $3,500 deduction from you. So he is willing to take a chance on your health. And he's providing you so-called health disclosure, healthy pricing. But he doesn't tell you what plan it is. He tells you, oh, I have a Blue Cross Blue Shield PPO. But when you come to a group, he didn't realize he has an HDHP account. That's the beauty of it. So the whole thing is, ultimately, it boils down to how you provide the care for all Americans. Larger employer groups, right now, as I see it, the larger employer groups have successfully, if you go to San Francisco, if you go to any large group employees, over 100, 200, they have successfully adopted to many of these incentives, and they are providing these incentives. They are getting this. And the beauty about the other thing, we know who is contributing to the health solutions advantage? The employees, but it is shared. Part of it is contributed by the employer, part of the contributed by the employer. So your rainy day is contributed both by employee. So you may pay only part of it, 1/3 of it, but the rest of the employee contributes to the health saving. So you could be proud of it, saying that I have a personalized healthcare. Yes, I have a personalized healthcare. Health insurance personalized. HIP, health insurance personalized, folks. Yes. So, folks, we need to, it's simple. I've gained this knowledge. I should tell you. Ron Bachman, he's an actuarial. One of these days, I may have to introduce Ron Bachman. I'll tell you about Ron Bachman. He has devoted his entire lifetime. He has been in the Congress. He has been he worked with both the Democrats and Republicans. He knows what exactly he's talking about. I have embraced his values. This is not, I'm just a messenger, folks. I'm just a messenger. Don't take me wrong. I'm not that bright enough, but Ron Bachman, we should congratulate Ron Bachman. I congratulate him on behalf of the Foremost organization. Foremost organization is a nonprofit, and we are in the same footholds, like same thing as Kaiser model. We want to encourage people to have personalized health insurance. And foremost organizations' goal is to achieve health insurance personalized and also have a public-private partnership. I love the Kaiser model because, you have brick and mortar owned by the Kaiser, but the staff model is for management is a for profit. I think it seems to work better when you have a public-private partnership. I believe in that model. I really believe that. So, guys, you're listening out there, please make some comments. I would love to interact with you guys. And I salute you all because this is, I've been in the healthcare, man. I want to give my till the give my passion of having healthcare free, personalized, not free, not good, personalized healthcare, so you can take charge of your health. This is an asset, folks, and foremost organization does a lot of things for the seniors. We do have a residential care. We do bingos, raise money, give the scholarships, vocational scholarships. Foremost organization goal is to focus on healthcare, research, technology, and more so on your health, man. We want to, foremost organization focused is on your health. That's what main focus is. Foremost organizations, if you would like to contribute, again, I have not set up any accounts yet, but one of these days we will have people contribute. If you do like this channel, subscribe, share, and hit the notification. This is an ongoing effort on my behalf as consumer's doctor. This is a lifetime goal, man. I want to see personalized healthcare for all Americans and take care of your asset. This is your body. This is your asset. It's like any other insurance, folks. And the beauty is you are in charge. We will see you in the next segment. Thank you.